Have you ever paused to consider why certain alterations in your body and mind are frequently dismissed as mere indications of growing older? In a world overflowing with medical guidance and treatment alternatives, it's easy to overlook the reality that some conditions we encounter in our mature years are entirely typical. In this video, we are going to reveal 8 prevalent health issues that many of us face as we advance in age, and why grasping these signals is essential for our overall well-being. If you're watching this video, comment "Great" below. Stick around until the conclusion to discover how embracing these inherent shifts can pave the way for a more vibrant and content existence, and why a serene state of mind is your greatest defense against unnecessary medical interventions and worry. Before we delve in, I would be grateful if you could give this video a thumbs up. You can continue to disseminate the wisdom of aging if you haven't already joined our community by subscribing. I suggest you hit that subscribe button and ring the notification bell so you won't miss any of our future insightful videos. Now, let's embark on this enlightening journey together. 1. Memory changes. As we gracefully progress through life, many of us observe the intriguing phenomenon of forgetfulness. It's not unusual to momentarily find ourselves in a mental fog, struggling to retrieve a recent conversation or pinpoint the location of a misplaced object. While these fleeting memory lapses can be unsettling, it's vital to understand that they don't automatically signify the onset of dementia or any severe cognitive impairment. Instead, they often represent a normal aging process that influences the brain. The brain, the command center of our entire being, orchestrates countless functions and activities. However, as the years accumulate, the quantity of neurons in our brain gradually diminishes, leading to subtle alterations in how we process and access information. This reduction in neuron count is an inherent part of the typical aging journey, and it can manifest as occasional absent-mindedness or difficulty recalling specific words. Fortunately, there are potent strategies to decelerate this decline and bolster cognitive health. Engaging in consistent physical activity has been demonstrated to enhance blood circulation to the brain, which, in turn, nourishes our neurons and supports their well-being. Just as our muscles require physical exertion to remain robust and functional, our brains also flourish on stimulation. Activities that challenge our cognitive abilities, such as immersing ourselves in books, maintaining a journal, tackling puzzles, or acquiring new skills, can significantly amplify brain activity and improve memory retention. Thus, while experiencing some level of memory change is a natural facet of aging, it's crucial to approach this aspect of life with understanding and proactive measures. Instead of succumbing to apprehension or fear regarding forgetfulness, we can embrace activities that enrich our minds and sustain our cognitive vitality. By integrating regular mental exercises into our daily lives, we can not only preserve but even enhance our memory and overall brain health as we navigate the remarkable voyage of aging. Comment "Mindful Aging" if you find this information reassuring. 2. Prostate enlargement. Prostate enlargement, also medically termed benign prostatic hyperplasia (BPH), is a prevalent occurrence within the male reproductive system, particularly as men advance in years. The prostate gland, responsible for producing seminal fluid, gradually increases in size over time due to the multiplication of prostate tissue. This process is exceptionally common among older men, with many experiencing some degree of enlargement as a natural component of the aging process. In the majority of instances, prostate enlargement does not lead to substantial discomfort or severe symptoms, rendering it a relatively benign condition. While some men might notice mild urinary issues, such as an increased need to urinate frequently or a sudden urge to go, these symptoms are generally manageable and not incapacitating. Importantly, the enlargement of the prostate often does not result in significant compression of the urethra, the tube that carries urine from the bladder out of the body. Consequently, many men find that their urinary function remains largely unaffected despite the growth of prostate tissue. The progression of prostate enlargement is typically gradual, unfolding at a much slower pace than other health conditions that might pose more serious risks to overall well-being. While BPH can lead to alterations in urinary patterns, it rarely causes functional impairment that would necessitate aggressive treatment or intervention. Numerous men live with prostate enlargement without ever requiring specialized medical attention or therapies. Overall, while prostate enlargement is a common and often anticipated aspect of aging in men, it usually does not lead to significant health concerns and is frequently monitored rather than actively treated. Regular checkups with a healthcare provider can help ensure that any changes in urinary health are appropriately assessed and managed. Comment Men's Health Matters if this information is helpful for you or someone you know. 3. Blurred vision. Vision changes are a prominent and significant indicator of the natural aging process of the eyes. As we get older, our bodies undergo numerous transformations, and our eyes are no exception. One of the most noticeable alterations is the gradual decline in elasticity within the eyeballs. This reduction in elasticity impacts the ability of the eye's lenses to adjust and focus on objects at varying distances, a function that is crucial for clear vision. Over time, these lenses become less effective at accommodating, leading to difficulties in focusing, particularly on close-up tasks. This common age-related vision issue is known as presbyopia, a condition that often manifests in middle age and becomes increasingly apparent as we advance in years. Presbyopia typically affects individuals over the age of 40, and those experiencing this condition might find themselves holding reading materials farther away to achieve a clearer view. Simple tasks such as reading a book, working on a computer, or even looking at a menu can become frustratingly challenging. This decline in focusing ability can significantly impact daily activities, making it essential for individuals to seek solutions that help maintain their vision quality. Maintaining good lifestyle habits is crucial for preserving vision health as we age. A well-balanced diet that includes a variety of vitamins and antioxidants is fundamental in promoting eye health. Nutrients such as vitamins C and E, lutein, and omega-3 fatty acids have been shown to support eye function and may help reduce the risk of age-related vision problems. Regular physical activity is equally important as it improves blood circulation and can have a positive effect on overall eye health. In addition to dietary and lifestyle considerations, it is vital to schedule routine eye examinations. These checkups serve as a proactive measure, allowing healthcare professionals to monitor vision changes and detect potential issues early on. Regular eye exams can help identify conditions such as glaucoma, diabetic retinopathy, and macular degeneration, which may not exhibit symptoms until they reach advanced stages. Early detection is key to managing these conditions effectively and preserving vision. However, it is essential to emphasize that vision problems in the elderly are not solely a consequence of the natural aging process. While conditions like cataracts are often associated with aging, they can also be triggered by a range of other factors. For example, genetics play a significant role. Individuals with a family history of eye diseases may be at a higher risk. Additionally, previous eye injuries can leave lasting effects that contribute to vision impairment later in life. Certain health conditions, such as diabetes and hypertension, are also linked to an increased risk of developing eye-related issues, underscoring the importance of managing overall health. Moreover, environmental factors, such as prolonged exposure to UV light without adequate protection or the cumulative effects of blue light from screens, can further impact eye health. This highlights the importance of protective measures such as wearing sunglasses when outdoors and using blue light filters on electronic devices to mitigate potential damage. Comment Clear Vision Journey if you've experienced or know someone experiencing these vision changes. I believe you're enjoying this video. Before we continue, make sure you subscribe, like, and share this video. Comment wonderful if you're enjoying this video. 4. Osteoporosis. Osteoporosis is a medical ailment defined by the progressive weakening of bones, resulting in amplified fragility and a heightened vulnerability to fractures. The term osteoporosis literally translates to porous bones, reflecting the structural alterations that occur within the bone matrix as it loses density and strength over time. This condition frequently arises due to a multitude of factors, with the gradual depletion of calcium being a primary contributor. As we age, our bodies become less efficient at absorbing calcium and other vital nutrients, leading to a reduction in bone density that can leave bones delicate and susceptible to injury. The process of bone loss is often insidious. Many individuals may not realize they are suffering from osteoporosis until they experience a fracture. These fractures can occur from seemingly minor falls or even through routine daily activities such as bending or lifting. Common sites for osteoporotic fractures include the hip, spine, and wrist. A hip fracture, for instance, can significantly impair mobility and independence, often necessitating extensive medical intervention and rehabilitation. Furthermore, spinal fractures can lead to chronic pain, deformities, and a diminished quality of life, emphasizing the importance of addressing bone health proactively. Several risk factors contribute to the development of osteoporosis. Age is a significant factor, as bone density tends to decrease after reaching peak bone mass in early adulthood. Gender also plays a crucial role. Women, particularly postmenopausal women, are at a higher risk due to the drop in estrogen levels, which is essential for maintaining bone density. Other contributing factors include family history, small body frame size, low physical activity levels, smoking, excessive alcohol consumption, and inadequate nutrition, particularly a deficiency in calcium and vitamin D. Preventing osteoporosis necessitates a comprehensive approach centered around nutrition and lifestyle choices. A well-rounded diet is fundamental for maintaining bone health. Calcium is a crucial mineral that forms the bedrock of bone structure. Adults generally require approximately 1,000 to 1,200 milligrams of calcium daily, depending on age and gender. Incorporating calcium-rich foods into the diet, such as dairy products, milk, cheese, yogurt, leafy green vegetables, kale, broccoli, collard greens, and fortified foods, orange juice, cereals, can significantly enhance calcium intake. Vitamin D, which aids the body in absorbing calcium, is also vital. This vitamin can be obtained from sunlight exposure, fatty fish, fortified dairy products, and supplements if necessary. In addition to a balanced diet, regular physical activity is critical in preventing osteoporosis. Engaging in weight-bearing exercises such as walking, jogging, dancing, and resistance training helps stimulate bone formation and can lead to increased bone density. These activities place stress on the bones, encouraging them to adapt and strengthen. It is generally recommended to aim for at least 150 minutes of moderate intensity exercise each week, along with muscle strengthening activities on 2 or more days. Regular checkups with healthcare professionals are also important for monitoring bone health, especially for individuals at higher risk of osteoporosis. Bone density tests, such as dual energy X-ray absorptiometry DEXA, can help determine bone mineral density and identify early signs of osteoporosis, allowing for timely intervention. Lifestyle modifications may include recommendations for dietary adjustments, exercise programs, and, in some cases, medication to help strengthen bones. Comment Strong Bones Journey if you're committed to improving your bone health. 5. Nodules. Nodules are defined as unusual lumps or masses that can form within various biological tissues throughout the body, and they can manifest in numerous different forms and locations. These growths can appear in organs such as the lungs, thyroid, liver, kidneys, and even in the skin. The formation of nodules can arise from a wide array of factors, including inflammation, infection, hormonal fluctuations, or even non-cancerous growth processes. It is important to emphasize that not all nodules are indicative of serious health concerns. In fact, many are benign and result from non-threatening conditions that do not require extensive medical intervention. The origins of nodules can be quite varied. For instance, nodules in the thyroid gland may occur due to hormonal imbalances or the presence of benign cysts, while lung nodules might arise from infections, granulomas, or even non-cancerous tumors. In some instances, nodules may also result from chronic inflammatory conditions such as rheumatoid arthritis or sarcoidosis. Understanding the specific cause of a nodule is crucial for determining its potential impact on health. When a nodule is identified, often through a physical examination, imaging study, or even incidentally during diagnostic scans for unrelated issues, healthcare professionals typically follow a systematic approach to evaluate its nature. The initial step usually involves a thorough medical history and physical examination to gather context regarding any symptoms the patient may be experiencing. This initial assessment can provide valuable insights into whether the nodule is associated with any notable changes in health. Following this, a series of diagnostic tests and evaluations are usually conducted. Imaging techniques such as ultrasound, computed tomography CT scans, or magnetic resonance imaging MRI are commonly employed to provide detailed information about the size, shape, and location of the nodule. These imaging studies help to visualize the nodule's characteristics and its relationship with surrounding tissues, which is crucial for making an informed initial judgment regarding its potential significance. For instance, the presence of calcifications within a nodule may suggest a benign process. while irregular borders might raise concerns about malignancy. In certain situations, a healthcare provider may recommend a biopsy to obtain a tissue sample from the nodule. This procedure involves extracting cells from the nodule, which can then be analyzed in a laboratory setting to determine their cellular composition. Biopsies can help differentiate between benign and malignant nodules, providing definitive information that guides treatment decisions. It is essential for patients and their families to understand the context of nodules in the medical landscape. The discovery of a nodule can understandably provoke anxiety as it raises questions about its nature and potential health implications. However, it is vital to remember that the vast majority of nodules are benign and may not necessitate aggressive treatment. Many nodules can be monitored over time through regular follow-up appointments and imaging studies, allowing healthcare providers to assess any changes in their size or characteristics. Through thorough investigation and thoughtful monitoring, healthcare providers can guide patients toward appropriate management options. This may include a watchful waiting approach for benign nodules, medical treatment for underlying conditions, or surgical intervention if there is concern regarding malignancy. Overall, the key to navigating the discovery of a nodule lies in effective communication with healthcare professionals who can provide clarity and reassurance based on a comprehensive understanding of the nodule's significance and the individual's overall health status. Comment "Understanding nodules" if you've learned something new about this topic. 6. Insomnia. In our younger years, the act of falling asleep often felt effortless, a natural transition from wakefulness to slumber that allowed us to enjoy a restful night's sleep without interruption. We would close our eyes at night, and almost as if by magic, we would drift off, only to awaken refreshed and rejuvenated in the morning. However, as we age, many individuals begin to notice a disturbance and alteration in their sleep patterns. What was once a simple and instinctive process can become a nightly struggle, with many finding themselves tossing and turning in bed, unable to find the peaceful rest they crave. This phenomenon of insomnia can stem from a multitude of factors, and understanding these influences is key to addressing the issue. One significant factor is the gradual desynchronization of our biological clock, our circadian rhythms, which regulate our sleep-wake cycles. As we grow older, these rhythms can become out of sync with our daily routines and commitments. Lifestyle changes, such as retirement, decreased physical activity, or altered social interactions, can further exacerbate this misalignment, making it more challenging to establish a consistent sleep pattern. Additionally, the pressures and challenges we face in our lives can weigh heavily on our minds, particularly during stressful periods. The culmination of responsibilities, worries, and the demands of daily life can lead to heightened anxiety, making it difficult to unwind and relax at night. As our bodies navigate various physical changes associated with aging, such as hormonal fluctuations and changes in metabolism, we may also experience increased discomfort, restlessness, or the need for more frequent trips to the bathroom, further complicating our ability to achieve restorative sleep. Regardless of the myriad reasons contributing to insomnia, it is essential to approach this condition with a calm and accepting mindset. Acknowledging that difficulties with sleep are a common experience, especially as we age, can help alleviate some of the anxiety and frustration that often accompany sleeplessness. It is vital to remember that insomnia is not an insurmountable challenge, but rather a condition that can be managed with patience and proactive strategies. To effectively combat insomnia and improve sleep quality, we must explore and implement various approaches tailored to our individual needs. Establishing a consistent sleep schedule is fundamental. This means going to bed and waking up at the same time each day, even on weekends. Such consistency helps reinforce our body's internal clock, making it easier to fall asleep and wake up naturally. Creating a calming bedtime routine can also significantly enhance our sleep experience. Engaging in relaxing activities before sleep, such as reading a book, practicing gentle yoga, or enjoying a warm bath, signals to our body that it is time to wind down. Additionally, it is important to cultivate an environment conducive to sleep. This includes ensuring that our bedroom is dark, quiet, and cool, which can greatly impact our ability to fall and stay asleep. Consider using blackout curtains, white noise machines, or comfortable bedding to create an ideal sleep setting. Moreover, lifestyle choices play a crucial role in sleep quality. Regular physical activity can help reduce stress and anxiety, promoting better sleep. However, it is important to avoid vigorous exercise close to bedtime, as it may have the opposite effect. Instead, focus on gentle movements or stretching in the evening. Additionally, paying attention to our dietary choices is essential. Avoiding caffeine and heavy meals in the hours leading up to bedtime can help prevent sleep disruptions. Practicing mindfulness and relaxation techniques can also be highly beneficial in managing insomnia. Techniques such as meditation, deep breathing exercises, or progressive muscle relaxation can help calm the mind and body, making it easier to transition into sleep. Exploring these practices during the day can create a sense of calm that carries into the night. Comment restful nights ahead if you're going to try some of these tips for better sleep. 7. Arterial plaque. Arterial plaque, commonly known as atherosclerosis, is a pathological process characterized by the gradual accumulation of plaques within the arterial walls. This buildup of fatty deposits, cholesterol, calcium, and other substances can lead to the hardening and narrowing of the arteries, significantly impeding blood flow. Arterial plaque formation is often regarded as a natural element of the aging process in the body's blood vessels, similar to the development of wrinkles on the skin, which can become more pronounced with advancing years. The prevalence of arterial plaque is notably concerning. Statistics suggest that nearly 40% of individuals over the age of 40 are affected by this condition. By the time people reach the age of 60, this figure can escalate to almost 100%, underscoring the widespread nature of atherosclerosis in the aging demographic. This condition can pose substantial health risks, as the constricted arteries may restrict blood supply to vital organs, elevating the likelihood of serious cardiovascular events such as heart attacks, strokes, and peripheral artery disease. Maintaining a heart-healthy lifestyle is paramount in preventing the formation of arterial plaques and mitigating the effects of atherosclerosis. Engaging in regular physical activity is one of the most effective strategies to promote cardiovascular well-being. Exercise helps to enhance circulation, reduce blood pressure, and lower cholesterol levels, all of which contribute to healthier arteries. Furthermore, adopting a balanced diet that is abundant in fruits, vegetables, whole grains, lean proteins, and healthy fats can further bolster heart health. Foods that are rich in omega-3 fatty acids, such as fish, and those packed with antioxidants, such as berries, have been shown to exert protective effects against arterial plaque formation. Moreover, abstaining from harmful habits such as smoking and excessive alcohol consumption is crucial in preserving arterial health. Smoking, in particular, is a significant risk factor for atherosclerosis as it damages the lining of arteries and accelerates plaque buildup. Maintaining a healthy weight and managing stress levels are also important components of a heart-healthy lifestyle. Excess weight can contribute to higher cholesterol levels and increased blood pressure, while chronic stress can lead to unhealthy coping mechanisms that further jeopardize cardiovascular health. Regular health checkups are equally vital in monitoring cardiovascular health. Routine screenings for cholesterol and blood pressure levels can help identify potential risks early, allowing for timely intervention and lifestyle adjustments. For those at higher risk of developing atherosclerosis, healthcare professionals may recommend additional strategies such as medication to manage cholesterol or blood pressure. In summary, arterial plaque formation, or atherosclerosis, is a common aspect of aging that carries significant health risks. However, individuals can take proactive steps to prevent and manage this condition through healthy lifestyle choices, including regular exercise, a balanced diet, avoiding harmful habits, and engaging in routine health checkups. By prioritizing cardiovascular health, individuals can significantly reduce their risk of developing serious complications associated with arterial plaque and lead a healthier, more active life as they age. Comment healthy heart habits if you're committed to taking care of your cardiovascular health. 8. Hearing changes. Another common experience as we age is a gradual change in our hearing abilities. Often referred to as presbycusies, this age-related hearing loss typically develops slowly over time. You might start noticing it's harder to hear high-pitched sounds, like birds chirping or the voices of women and children. Background noise can also become more problematic, making it difficult to follow conversations in crowded places like restaurants or social gatherings. It's not uncommon for individuals experiencing presbycusies to ask others to repeat themselves or to turn up the volume on the television or radio. While these changes can sometimes feel isolating or frustrating, it's important to understand that they are a very common part of the aging process. affecting a significant portion of the older adult population. In fact, after the age of 65, approximately 1 in 3 people experience some degree of hearing loss. This gradual decline in hearing is primarily due to natural changes in the inner ear and the auditory nerve. The tiny hair cells in the inner ear, which are responsible for converting sound waves into electrical signals that are sent to the brain, can become damaged or die off over time. This damage can be accelerated by factors such as prolonged exposure to loud noises throughout life, certain medical conditions like diabetes or high blood pressure, and even genetics. While age-related hearing loss is a natural process, it's crucial to address it appropriately. Untreated hearing loss can have a significant impact on an individual's quality of life, potentially leading to social isolation, depression, and even cognitive decline. If you notice changes in your hearing, it's essential to consult with an audiologist. They can perform a comprehensive hearing evaluation to determine the extent and type of hearing loss and recommend appropriate solutions. For many individuals, hearing aids can significantly improve their ability to hear and communicate effectively. Modern hearing aids are sophisticated devices that can be customized to individual needs and preferences. They can amplify sounds, filter out background noise, and even connect wirelessly to smartphones and other electronic devices. Beyond hearing aids, there are other strategies that can help manage hearing changes. These include using assistive listening devices in public places, asking people to speak clearly and face you when they are talking, and reducing background noise whenever possible. Engaging in social activities and staying connected with friends and family is also crucial for maintaining overall well-being, even if communication becomes more challenging. Remember, experiencing changes in your hearing as you age is not a sign of weakness or something to be ashamed of. It's a common physiological change that can be effectively managed with the right support and interventions. Don't hesitate to seek professional help if you're noticing difficulties with your hearing. Comment sound advice if you found this information about hearing changes helpful. Why can overtreatment harm the body? From a medical perspective, overtreatment presents considerable risks to the body. Every medication or treatment approach, while intended to alleviate health issues, carries potential side effects that can inflict harm if not meticulously managed. When treatment surpasses the necessary extent, it can trigger a series of adverse reactions, compromising overall health. For instance, the excessive use of antibiotics can disrupt the delicate equilibrium of gut flora, which is vital for digestion and overall immunity, potentially leading to conditions like antibiotic-resistant infections. Similarly, excessive radiation therapy can inflict damage not only on targeted cancer cells, but also on surrounding healthy tissues, increasing the risk of secondary cancers and other complications. Furthermore, unnecessary surgical procedures can compromise bodily functions, leading to complications such as infections, prolonged recovery periods, and even long-term impairment of physical abilities. Beyond the physical ramifications, overtreatment can significantly impact mental health. The psychological burden associated with aggressive treatment regimens can amplify feelings of anxiety and depression among patients. The stress of frequent medical appointments, the apprehension of side effects, and the uncertainty of treatment outcomes can all contribute to a decline in mental well-being, making it essential to approach medical interventions with a balanced perspective. How should we prevent overtreatment as individuals age? As individuals age, a common perception arises that various diseases are on the horizon, largely due to the natural decline in bodily functions that accompanies aging. To effectively prevent disease and mitigate the risks associated with overtreatment, it is crucial to prioritize lifestyle adjustments and the development of healthy habits. Maintaining a consistent biological clock is paramount. Adopting a routine that involves going to bed early and rising each day ensures that the body receives the adequate rest it needs to recover and rejuvenate. Sufficient sleep not only enhances physical health, but also supports cognitive function and emotional resilience. It is essential to avoid late-night activities and harmful habits, as these can disrupt the body's natural rhythms, ultimately leading to decreased immunity and an increased risk of health issues. A balanced diet is equally vital in the prevention of diseases, particularly for the elderly. Older adults should emphasize the importance of nutrition by consuming a variety of foods rich in essential nutrients, including proteins, vitamins, and minerals. Foods such as fish, lean meats, eggs, dairy products, legumes, fresh vegetables, and fruit should be staples in their diet. Simultaneously, reducing the intake of high-fat, high-calorie, high-salt, and high-sugar foods is critical, as these dietary choices can significantly lower the risk of chronic conditions such as cardiovascular diseases and diabetes. Physical exercise is another crucial element of disease prevention for older adults. Engaging in moderate physical activity can boost the body's resistance to illness and slow down the aging process. Seniors can opt for light exercises such as walking, tai chi, and yoga, tailoring their exercise routines to suit their personal preferences and physical capabilities. Furthermore, maintaining a positive mindset is essential for overall well-being. Approaching life with optimism and resilience can help alleviate stress and enhance immune function. Social interactions, whether through family gatherings or community activities, provide valuable opportunities for connection, allowing elderly individuals to share experiences and celebrate the beauty of life's later years. In navigating the inevitable changes that come with aging, it is crucial to maintain a calm and rational mindset. Arranging daily life in a balanced way and focusing on healthy living can foster resilience against the challenges of aging. It is important to filter out unverified information and place trust in scientific knowledge. Ultimately, the keys to sustaining good health lie in appropriate exercise, a balanced diet, and fostering a positive outlook on life. Thank you for joining us today as we explored these 8 common signs of aging and how to navigate them with a positive mindset. We hope you found valuable insights that can help you embrace this natural phase of life. What have you learned so far? We'd love to hear from you. Share one key takeaway in the comments below that you plan to incorporate into your daily life. If you enjoyed this video, please leave your comment below and don't forget to like, share, and subscribe to our YouTube channel. Together, let's continue to grow, learn, and support each other on this journey toward healthy aging. Remember to check out other interesting and informative videos on our channel before you go. We have a wealth of content designed to help you live your best life at any age. See you in the next video.